Welcome to Graceful Years. Picture this. You're 75 years old, living independently, proud of your self-sufficiency. You've raised a family, built a career, and navigated decades of life's challenges. Yet somehow, the simple routines you've done thousands of times are becoming complicated. Today we're diving into a topic that affects millions but is rarely discussed openly. The hygiene challenges that come with aging. This isn't about shame or embarrassment. It's about understanding, adapting, and thriving. Whether you're an older adult yourself, caring for aging parents, or simply want to prepare for the future, this information could be life-changing. We'll explore the 7 most common hygiene mistakes older adults make, why they happen, and most importantly, practical solutions that restore confidence and independence. Some of these insights might surprise you, and others might feel like a gentle wake-up call. But every single point we cover today comes from a place of respect and genuine care. So let's begin this important conversation about maintaining dignity, health, and quality of life as we age. Mistake number 1. Inadequate oral care. Our first stop might shock you. Did you know that nearly 70% of adults over 65 have gum disease? Yet many older adults continue using the same oral care routine they've had for decades, not realizing their needs have dramatically changed. Here's what's happening behind the scenes. As we age, our saliva production decreases. Saliva is nature's mouthwash. It neutralizes acids, washes away food particles, and fights bacteria. Less saliva means more problems. Additionally, many medications cause dry mouth as a side effect, compounding the issue. The mistake isn't just about brushing less frequently, though that certainly happens when arthritis makes holding a toothbrush painful, or when memory issues disrupt routines. The bigger problem is using outdated techniques and tools. Many older adults still use hard-bristled toothbrushes from an era when scrubbing harder was considered better. But aging gums are more delicate and recede more easily. They need gentler care, not more aggressive cleaning. Then there's the flossing challenge. Traditional floss becomes nearly impossible when fingers lose dexterity or when shoulder mobility decreases. Yet many people simply stop flossing rather than finding alternatives. The consequences go far beyond bad breath. Poor oral hygiene in older adults is linked to heart disease, stroke, diabetes complications, and pneumonia. When bacteria from the mouth enters the bloodstream through inflamed gums, it can cause serious systemic infections. But here's the encouraging news. Small changes make enormous differences. Electric toothbrushes can compensate for reduced manual dexterity. Water flossers eliminate the need for traditional floss manipulation. Alcohol-free mouthwashes won't worsen dry mouth. And scheduling regular dental cleanings becomes even more crucial as we age, not less important as many people assume. The key insight? Oral care isn't just about teeth. It's about overall health and quality of life. Mistake number 2. Overbathing and under-moisturizing. This might sound counterintuitive, but many older adults are actually bathing too frequently and in ways that damage their skin. It's a mistake rooted in lifelong habits that no longer serve aging bodies. Here's the science. Older skin produces less oil and retains less moisture. The skin barrier becomes thinner and more fragile. What worked at 30 or even 50 can be harmful at 70. Yet many older adults maintain daily hot showers or baths, using the same soaps they've always used. They might even increase bathing frequency if they notice body odors, not realizing they're creating a cycle that makes the problem worse. Hot water strips away the skin's natural protective oils. Harsh soaps, especially antibacterial ones, further damage the skin barrier. The result? Skin becomes dry, itchy, and more prone to tears and infections. Ironically, damaged skin can actually develop more odor problems because bacteria thrive in compromised skin environments. But there's another layer to this issue. The emotional component. For many older adults, daily bathing represents normalcy, dignity, and self-care. The idea of bathing less frequently can feel like giving up or becoming dirty. This is where family conflicts often arise. Adult children might encourage daily bathing without understanding the physical consequences. The solution isn't about lowering standards. It's about smarter hygiene. Lukewarm water instead of hot. Gentle, fragrance-free cleansers instead of harsh soaps. Focusing thorough cleaning on areas that need it most. Underarms, groin, feet, and any skin folds. And here's the game changer. Immediate moisturizing. Applying moisturizer to damp skin within 3 minutes of bathing locks in moisture far more effectively than waiting until skin is completely dry. Some older adults benefit from alternating full baths with spot cleaning days, maintaining cleanliness without overdrying skin. Others find that adding oils to bath water helps maintain skin integrity. The takeaway? Good hygiene isn't about frequency. It's about effectiveness and skin health. Mistake number 3. Neglecting foot care. If eyes are the windows to the soul, feet might be the windows to overall health, especially for older adults. Yet foot care is often the most neglected aspect of hygiene, with potentially serious consequences. Let's start with why feet become problematic as we age. Circulation decreases, making feet cooler and healing slower. Flexibility diminishes, making it harder to reach feet for care. Vision changes make it difficult to inspect feet properly. Diabetes, common in older adults, can cause nerve damage that reduces sensation in feet. The most common mistake? Simply not looking at feet regularly. Many older adults go weeks or months without really examining their feet, especially the soles and between toes. They might notice pain or discomfort but attribute it to normal aging, rather than investigating further. Then there's nail care. Toenails often become thicker and harder to cut with age. Many older adults continue using the same small nail clippers they've always used, struggling to cut through thick nails. This leads to several problems. Nails may be cut too short, causing ingrown nails. They may be left too long, causing pressure and pain in shoes, or they may be cut improperly, creating sharp edges that can tear socks or scratch the other foot. Foot hygiene itself often suffers. The areas between toes may not be dried properly after bathing, creating perfect conditions for fungal infections. Dead skin may accumulate on heels and soles because the natural sloughing process slows with age. Perhaps most dangerously, many older adults continue wearing poorly fitting shoes. Feet can change size and shape with age due to conditions like arthritis, but people often stick with their long-time shoe size. Ill-fitting shoes cause blisters, calluses, and pressure sores that can become serious problems, especially for people with diabetes or circulation issues. The solutions are more straightforward than you might think, but they require a shift in perspective. Foot care needs to become a priority, not an afterthought. This might mean investing in proper nail care tools, including heavy-duty clippers designed for thick nails. It could mean using a long-handled sponge to reach feet more easily during bathing. Regular foot inspection should become as routine as brushing teeth. Using a mirror to check the soles, or asking a family member for help when flexibility is limited. Professional pedicures aren't just luxury. For many older adults, they're essential health care. And here's something many people don't realize. Feet should be measured regularly. Professional shoe fitting should happen at least once a year, as foot size and shape continue to change throughout our lives. Mistake number 4. Inadequate hair and scalp care. Hair care is where vanity meets health, and for older adults, the stakes are higher than many realize. The most common mistake isn't just about appearance. It's about scalp health, which directly impacts comfort, confidence, and even social engagement. As we age, hair undergoes dramatic changes. It becomes thinner, more fragile, and grows more slowly. The scalp produces less oil, which might seem like a good thing, but it actually means the scalp needs different care. Many older adults continue using the same shampoo routine they've had for decades, not realizing their hair and scalp needs have completely changed. Overwashing is a major issue. That daily shampoo routine that worked beautifully at 40 can leave aging hair brittle and the scalp irritated at 70. Yet many older adults increase washing frequency if they notice their hair looking different, not understanding that they might be contributing to the problem. On the flip side, some older adults go too long between washes, especially if washing has become physically difficult. Standing in the shower with arms raised to wash hair can be exhausting when balance is uncertain or arthritis makes movement painful. The result? Scalp oils and dead skin cells accumulate, potentially leading to itching, flaking, and even infections. Then there's the styling challenge. Many older adults continue using heating tools, harsh chemicals, or tight hairstyles that were appropriate for younger, stronger hair. Aging hair simply can't handle the same treatments without damage. But here's where it gets interesting. Hair problems in older adults often reflect broader health issues. Sudden hair loss, changes in texture, or scalp problems can indicate nutritional deficiencies, medication side effects, or underlying health conditions. Yet these signs are often dismissed as normal aging, rather than investigated. The styling aspect carries emotional weight too. For many older adults, especially women, hair represents identity and attractiveness. When hair changes become dramatic, it can trigger depression or social withdrawal. Some people become so frustrated with their changing hair that they stop caring for it properly, creating a cycle of deterioration. Solutions start with understanding that hair care needs to evolve with age. This might mean switching to gentler, sulfate-free shampoos. It could involve reducing washing frequency while improving the quality of each wash. Conditioning becomes more important, not less, as hair loses its natural moisture. For those who find traditional hair washing difficult, there are alternatives. Dry shampoos for extending time between washes, rinse-free shampoo caps for when standing is difficult, or professional salon services that specialize in older adult care. The key insight? Hair care isn't about maintaining a youthful appearance. It's about maintaining a healthy scalp and preserving whatever hair remains in the best possible condition. Mistake number 5. Poor intimate hygiene practices. This is perhaps the most sensitive topic we'll discuss today, but it's crucial because intimate hygiene mistakes can have serious health consequences for older adults. The challenges are real, the solutions exist, and open conversation can prevent significant problems. Let's address the elephant in the room. Aging affects intimate areas in ways that require adjusted hygiene practices. For women, decreased estrogen after menopause changes the vaginal environment, making it more alkaline and less able to fight off harmful bacteria. The tissue becomes thinner and more fragile. For men, changes in mobility and flexibility can make thorough cleaning more difficult. The most common mistake is using products that are too harsh. Many older adults use regular soap or feminine hygiene products with fragrances, not realizing that aging intimate tissue is more sensitive and prone to irritation. What didn't cause problems at 40 might cause burning, itching, or infections at 70. Overwashing is another issue. Some older adults, noticing changes in natural scents or experiencing incontinence issues, may increase cleaning frequency or use stronger products. This can disrupt the natural bacterial balance and actually increase odor and infection risk. On the other end of the spectrum, some older adults may avoid thorough cleaning due to mobility issues, embarrassment, or fear of causing discomfort. This can lead to bacterial overgrowth, infections, and skin breakdown. Incontinence adds another layer of complexity. Many older adults experience some degree of urinary or fecal incontinence but don't adjust their hygiene routines accordingly. They might not clean thoroughly enough after episodes, or they might use harsh products trying to eliminate odors. The emotional component can't be ignored. Changes in intimate areas can affect self-image and relationships. Some older adults become so self-conscious that they avoid intimacy altogether, which can impact mental health and relationship quality. But here's the encouraging news. Most intimate hygiene challenges in older adults have straightforward solutions. Gentle pH-balanced cleansers designed for sensitive skin work much better than regular soap. Plain water is often sufficient for daily cleaning. Pat drying instead of rubbing prevents tissue damage. For incontinence issues, barrier creams can protect skin from moisture damage. Frequent pad or undergarment changes prevent bacterial buildup. There are also specialized cleansing foams and wipes designed specifically for incontinence care. Regular gynecological or urological care becomes more important with age, not less. Many intimate hygiene problems that older adults struggle with have medical solutions. Hormone treatments, medications, or procedures that can dramatically improve quality of life. The key message: intimate hygiene challenges are common, treatable, and nothing to be ashamed of. They're a normal part of aging that deserves proper attention and care. Mistake number 6. Ignoring body odor changes. Body odor in older adults is a complex issue that goes far beyond simple cleanliness. The most common mistake is assuming that stronger soap, more frequent bathing, or heavier deodorant will solve the problem. In reality, body odor changes in older adults often have underlying causes that require different approaches. First, let's understand what's happening physiologically. As we age, our sweat composition changes. We may sweat less overall, but the sweat we produce can be more concentrated. Hormonal changes affect natural body scents. Medications can alter body chemistry in ways that create new odors. Health conditions like diabetes, kidney problems, or liver issues can cause distinctive body odors that no amount of washing will eliminate. Then there's the medication factor. Many older adults take multiple medications, and some combinations can create unusual body odors. Certain antibiotics, for example, can cause a metallic smell. Some blood pressure medications affect how the body processes certain compounds, leading to different scents. The skin itself changes in ways that affect odor. Slower cell turnover means dead skin cells accumulate more readily, potentially trapping bacteria and creating odor. Changes in skin pH can alter the bacterial environment, leading to different smells even with the same hygiene routine. But here's where it gets complicated. Some older adults become nose-blind to their own odors, while others become hyper-aware of scents that may not be noticeable to others. This can lead to either insufficient attention to hygiene or obsessive overcleaning that makes problems worse. Clothing plays a bigger role than many realize. Older adults may hold onto clothing longer, and fabrics can retain odors even after washing, especially synthetic materials. They might also dress more warmly due to changes in temperature regulation, potentially increasing sweating and odor. The laundry factor is often overlooked. Some older adults reduce washing frequency to save money or energy, not realizing that certain odors require special treatment. Urine odors, for example, need enzymatic cleaners, not just regular detergent. Social isolation can compound the problem. If older adults aren't around others regularly, they may not receive feedback about odor issues. Family members might notice problems during visits but feel uncomfortable addressing them. The solutions require detective work. If body odor changes suddenly or dramatically, it's worth consulting a healthcare provider to rule out underlying health issues. Sometimes treating a medical condition resolves odor problems entirely. For hygiene-related odors, the solution isn't always more cleaning. It might be changing products, adjusting techniques, or addressing specific areas that need extra attention. Antimicrobial soaps might help for some people, while others need gentler products that don't disrupt their skin's natural balance. Clothing hygiene becomes more important with age. This might mean washing clothes more frequently, using different detergents, or replacing items that retain odors despite cleaning. Mistake number 7. Neglecting hand hygiene and nail care. Our final common mistake might seem basic, but hand hygiene and nail care in older adults involve subtleties that can have significant health and safety implications. The most dangerous assumption is that hand-washing techniques that work throughout life will continue to be adequate as we age. Here's what changes. Hand skin becomes thinner and more fragile with age. Nails may become thicker, more brittle, or develop ridges. Arthritis can make thorough hand-washing painful or difficult. Vision changes might make it harder to see dirt under nails or notice skin problems on hands. The washing technique itself often needs adjustment. Many older adults continue using hot water and harsh soaps, not realizing that aging hand skin needs gentler treatment. They might rush through hand washing due to discomfort, missing areas that harbor bacteria. Nail care presents unique challenges. Fingernails that were easy to trim with small clippers might now require different tools. Some older adults stop trimming nails regularly because it becomes difficult, leading to overgrown nails that can harbor bacteria and make other hygiene tasks more challenging. Then there's the intersection of hand hygiene with overall health. Older adults are more susceptible to infections, making proper hand hygiene even more critical. Yet they might be less thorough due to physical limitations. They're also more likely to be on medications that suppress immune function, making every exposure more risky. The medication handling aspect is often overlooked. Many older adults take multiple medications daily, but if their hands aren't properly clean, they could contaminate their medications or introduce bacteria into their mouths during pill taking. Cooking safety becomes a concern too. Older adults who continue cooking might not adjust their hand hygiene practices to account for changes in vision or dexterity that could lead to inadequate cleaning after handling raw foods. Social implications matter as well. Hands are highly visible, and unkempt nails or obviously dirty hands can affect social interactions and self-esteem. Some older adults become self-conscious about their hands and withdraw from activities like shaking hands or participating in group activities. The solutions focus on adaptation rather than elimination of the problem. This might mean installing lever-style faucets that are easier to operate than knobs. Using lukewarm water instead of hot to prevent skin damage. Choosing gentler soaps or even alcohol-based hand sanitizers when appropriate. For nail care, investing in proper tools designed for older adults can make a significant difference. This might include magnifying glasses for better visibility, ergonomic nail clippers that require less force, or professional manicure services for those who can no longer manage nail care independently. Hand moisturizing becomes critical, not optional. Applying moisturizer immediately after hand washing helps maintain skin integrity and prevents cracks that can harbor bacteria. Conclusion: 2030 to 2200 hours. As we wrap up our discussion of these 7 common hygiene mistakes, it's important to remember that aging isn't about declining standards. It's about adapting strategies to meet changing needs. Every challenge we've discussed today has practical solutions that can restore confidence, improve health, and enhance quality of life. The overarching theme is this: what worked at 30, 40, or even 60 might not work at 70 or 80, and that's perfectly normal. The key is recognizing when changes are needed and being willing to adapt. Some adaptations are simple product swaps, gentler soaps, different tools, or new techniques. Others might require professional help, whether that's from healthcare providers, hygienists, or family members. None of these represent failure or loss of independence. They represent smart adaptation to life's changes. For family members watching older adults struggle with these issues, remember that approaching these topics requires sensitivity and respect. Focus on solutions rather than problems, offer help rather than criticism, and recognize that maintaining dignity is just as important as maintaining hygiene. The ultimate goal isn't perfection. It's finding sustainable routines that promote health, comfort, and confidence. Every small improvement makes a difference, and it's never too late to make positive changes. If you found this information helpful, consider sharing it with others who might benefit. These conversations, while sometimes uncomfortable, can literally be life-changing for older adults and their families. Remember, aging with dignity includes maintaining the best possible hygiene practices for your current abilities and circumstances. You deserve to feel clean, comfortable, and confident at every stage of life. Thank you for joining this important conversation. Here's to healthier, happier aging for all of us.